This chapter will help you understand brain injury and more about your loved one's diagnosis of traumatic brain injury, sometimes called TBI for short. Traumatic brain injuries are those caused by a blow to the head or from violent movement of the head.
That could be from striking the head against a car windshield. It could be related to a fall and striking the head. It could be related to military explosion or shrapnel penetrating the skull.
A person does not have to have an open head wound, a skull fracture, or even a loss of consciousness to sustain a traumatic brain injury.
No two people are alike, and no two brain injuries are alike. Doctors classify traumatic brain injuries as mild, moderate, or severe, depending on the initial length of loss of consciousness and post-traumatic memory loss. There are overlaps in the symptoms of each of these classifications. The terms mild, moderate, and severe may not correlate or describe the expected outcomes in a person's life.
A mild traumatic brain injury occurs when the patient initially loses consciousness for 15 minutes or less, if they have any memory loss about the trauma event, or they feel dazed, disoriented, or confused. It's often called a concussion. The majority of traumatic brain injuries are initially rated as mild. Moderate traumatic brain injuries include a loss of consciousness from 15 minutes to a few hours, followed by a few days or weeks of confusion. Severe traumatic brain injuries affect less than 10% of patients and involve a loss of consciousness for 6 hours or longer after injury, or after a period of clarity. People who remain unconscious for a very long time may be in a coma or a vegetative or minimally conscious state.
Physical symptoms of traumatic brain injury can include difficulty coordinating balance and walking, blurred vision, headaches, trouble speaking and swallowing, and lack of bowel and bladder control. People with traumatic brain injury may have trouble moving their body normally. Doctors call this motor impairment. The person may have seizures, vision problems, and changes in sensory perceptions, sleep patterns, and sexual function. Persons with traumatic brain injury can have personality changes, trouble communicating, and memory impairments. They may also be depressed and disoriented, have mood swings, be forgetful, and have difficulty forming sentences or choosing vocabulary. They may act inappropriately and struggle with reason, focus, and logic. After a brain injury, conversation with your loved one may be difficult. He or she may have poor concentration, a limited attention span, or difficulty remembering what was said.